Good morning. Could I ask you to please confirm the name and date of birth?
It's Rian van Wyk, the 6th of April 1977.
Good morning, Graham. I've been asked to do a respiratory examination on you today, so it's going to mean you removing your shirt and it will have me examining your chest. Is that going to be okay with you?
No problem.
Perfect. Graham, if you could just remove the shirt. So, Rian, the ideal position to examine you would be just sitting on the bed. Upon an inspection, Rian has a normal chest shape. He has a normal AP diameter, so no barrel chest. I don't notice any pectus carinatum or pectus excavatum. He doesn't have any Harrison sulcus. And then also looking in his chest, there's no neck vein distension, and he doesn't have any chemical burn wounds from previous radiation therapy. I also don't notice any scars, and also no scars from a previous intercostal drain. So preferably I'd look at the symmetry of his breathing from above, but he's quite tall, so looking from the front, he's got a normal symmetrical expansion of his chest. Then, Rian, I'm just going to quickly feel for your trachea. I just want to make sure that it is indeed central, which it is. And then I'm going to just palpate for the apex beat again. And measure it. And it is in the 5th intercostal, just medial of the midclavicular line. So I'm happy with that. Rian, I'm just going to look at your chest expansion now. So just taking hold firmly, moving my thumbs across to the epigastric region, just breathing deep. And the two things I'm looking for is firstly symmetrical expansion, which he has, and secondly the amount of expansion, and it needs to be at least 5 centimeters. Movement between my thumbs, which it is. Had my thumbs crossed over, it would have been known as a positive Hoover sign, which we sometimes see in patients with COPD. Rian, I just want to feel if there's any tenderness. Does it hurt when I squeeze?
No.
Okay, I squeeze like this. Any
No.
tenderness? Right. Then I'm going to test for vocal fremitus. Rian, if you can just say the words 111.
111. 111. 111.
And Rian's
111.
vocal fremitus.
111.
He has normal pulsations both sides.
111.
111.
111. 111.
Okay, so I'm happy with the vocal fremitus. Then we're going to proceed to percussion. So I'm going to start supraclavicular, comparing left and right. That's for the apical mass, and then over the clavicle. And these are equal both sides. And percussing Rian's chest, he's nice and resonant, bilaterally, and also in the anterior axillary line. And he percusses resonant both sides. Then we're going to listen to your lungs, Rian. So I just want you to breathe in and out. Actually, I'm going to just start supraclavicular, using the bell of my stethoscope. Breathe deep. So listening to Rian's breathing, he has normal vesicular breathing with normal air entry, and I did not hear any additional sounds. Moving to Rian's back, everything we do in the front, we do in the back, and we're always comparing left and right. So Rian doesn't have any skeletal abnormalities as mentioned. He also doesn't have a kyphosis or scoliosis. If I look at his breathing, it is symmetrical both sides. He doesn't have any surgical scars. There are ever some minor scars from previous nevus removal. Rian, I'm going to ask you just to put your arms across there, and once again I'm going to be percussing, comparing left and right. And Rion percusses resonant both sides. Right, Rion, I'm going to ask you once again to take a deep breath. And once again, Rion has a nice symmetrical expansion with at least 5 centimeters present. Anterior, we're looking at the upper lobes, and posterior at the lower lobes. So I'm happy with that. Rion, if you could just say 111 again.
111. 111. 111. 111.
And there's no accentuated vocal fremiters. We're now just going to listen to your breath sounds again, nice and deep. And once again, Rion has normal air entry with normal vesicular breathing. And I breathe deep. I do not any additional sounds. Now you can either do vocal friendliness or vocal resonance. If you were doing vocal resonance, just say 111 again.
111. 111. 111.
These sounds are being
111.
transmitted symmetrically, so no elevated vocal fremiters. So in summary, your examination is perfectly normal. Your lungs are aerating normal, and I do not hear any additional sounds. So I'm happy that this is a normal respiratory examination. So thank you, and you can get dressed again.
Thank you.
I'm just going to wash my hands.